Hey everyone, welcome to your final exam review explainer. I'm stepping in as your lead nurse mentor today, and honestly, I am so incredibly excited to guide you through this. We are looking at the absolute essentials of stepping into a new clinic manager role. So we're going to take some pretty heavy concepts and distill them into clear, actionable takeaways. This isn't just about passing a test, right? It's about prepping you for your actual future practice. We're covering the whole shebang, from running a nurse-led clinic all the way up to tackling macro-level population health. Okay, let's take a really quick look at our roadmap for this explainer. We're going to hit 6 key areas today, starting off at the micro level with leading the clinic model, moving through team building and program planning, and then zooming all the way out to managing population health. All right, diving right into section 1, leading the clinic model, focusing on the foundations of nurse-led care. So, as a brand new clinic manager, your absolute first priority is wrapping your head around this core concept. In nurse-led health centers, the decision-making and accountability, that rests squarely on our shoulders. It's up to nurses to really address those social determinants of health. Now, there are 3 primary service models you've got to know. First, comprehensive primary healthcare centers. These are your true medical homes. Think federally qualified health centers, offering physical and behavioral health for a person's entire lifespan. Next up, special care centers. These are more like adjuncts to primary care that require highly specialized skills, kind of like nurse-family partnerships. And finally, wellness centers. These are all about health promotion, getting immunizations done, and offering enabling services, like, say, transportation vouchers, so folks can actually get to their appointments. Make absolutely sure you know the distinct structural focus of each of these for your exam. Moving right along to section 2, building your collaborative team and understanding those key roles and responsibilities. Here's the truth. You literally cannot manage a clinic in a silo. It just doesn't work. You absolutely need an interprofessional collaborative practice, or IPCP, that is completely customized to your specific community's needs. Imagine this teamwork in action during a community assessment. You've got nurse practitioners delivering an expanded level of care. Working right alongside them are care coordinators, who are making sure patients transition smoothly across different care settings. And, crucially, you have social workers diving into social assessments to tackle the fallout from social determinants of health. It's like a giant puzzle, and together, this entire team maps out those really complex, multi-level interventions. Okay, section 3, planning health programs, with a focus on community health planning. So, shifting from building our team to actually taking action, health program planning is all about deliberately putting the public's well-being way above any private interests. Let's do a really quick knowledge check here, because you absolutely need to know this terminology for the exam. Which of the following is a specific, measurable outcome? Is it a mission, an objective, a goal, or an action step? Think about it for a second. Well, a mission is basically a statement of your values, right? And a goal is a super broad overall aim. But the objective, that is your specific, measurable outcome. Action steps are just the actual tasks you check off to hit those objectives. Keep those definitions crystal clear. Now, when you're in the thick of the planning phase, you're inevitably going to have to weigh different options and figure out what's most effective. That's where the multi-attribute utility technique comes in. We call it MOUT for short. It's rooted in decision theory. The literature outlines a 10-step process, but we can really boil it down to a core strategic flow. You formulate the problem, brainstorm your alternatives, figure out and rank your criteria, assign them some quantifiable value, calculate the utility of each option, and bam, you select the best solution. It totally takes the guesswork out of making those really tough, complex clinic management decisions. Which brings us to section 4, evaluating for success and ensuring program accountability. Okay, so you've planned this brilliant program and it's finally running. Now what? Well, we have to implement a systematic way to evaluate and tweak things. The biggest thing here is knowing the difference between 2 specific types of evaluation. Formative evaluation, you'll also hear it called process evaluation, is your ongoing check-in. It's happening while the program is running to make sure you're actually hitting your objectives and your activities are on track. Summative evaluation, on the other hand, also known as impact evaluation, is all about the end game. It's the assessment of your final outcomes or the follow-up results. Basically, one checks the journey and the other measures the destination. Let's apply that real quick. If I ask you, which evaluation ensures that all your planned activities are being implemented right now? Based on what we just talked about, it's formative evaluation. Since it's an ongoing, real-time process, it's the tool that actively makes sure your daily clinic operations are doing exactly what they're supposed to do way before the program actually wraps up. And why do we care so much about this? Because this evaluation process is literally how we build our case for funding and sustainability. Program evaluation relies a ton on qualitative methods and really solid program records. Meticulous, organized record keeping is the exact proof you need to justify keeping a program going, making adjustments, expanding it, or if it's not working, shutting it down. It proves to both your clients and your funders that you are actually fulfilling your purpose. All right, on to Section 5, improving care quality, looking specifically at performance improvement in the U.S. Let's take a step back and look at the broader healthcare system for a second. To maintain quality, you really need to grasp how care is organized and paid for. For the exam, you must understand the difference between MCOs and ACOs. Managed care organizations popped up back in the 70s mainly to cut costs. They stick to a very specific budget, they use HMO or PPO models, and they lean heavily on gatekeepers. Now, contrast that with accountable care organizations, or ACOs. This is a newer setup where providers are financially rewarded specifically for coordinating care effectively. They're highly interdisciplinary, patient participation is totally voluntary, and here's the kicker. There are no gatekeepers or strict lock-in referrals required. It's a huge mindset shift from restricting budgets to rewarding great coordination. And whether you're in an MCO or an ACO, when you want to implement performance improvement, you are going to rely on this constant loop. Plan, do, check or study, and act. The PDCA or PDSA cycle. Honestly, this is the absolute gold standard method for driving continuous performance improvement in your day-to-day clinic operations. Finally, we've reached Section 6, managing population health, adopting that macro-level approach. Listen, as you step into a nurse leadership role, your responsibility really grows. You elevate from just running a single clinic to actually managing the health of entire populations. We are zooming all the way out. There's a great directive from Healthy People 2030 that perfectly sums this up. It urges us to engage leadership and the public across multiple sectors to design policies that improve overall well-being. We aren't just treating the sick person sitting in exam room A anymore. We're actively working to fix those massive, glaring differences in life expectancy that are tied to gender, race, and income. It's a totally transformational approach. But to pull off a mission that big, you need a specific set of skills. You've got to master value-based care. You absolutely have to look at the whole picture, especially those social determinants of health, like the economic and environmental conditions your patients actually live in. Plus, you need to be an absolute pro at care coordination, interdisciplinary collaboration, and fierce advocacy. Think of these as the essential toolkit for the modern nurse leader. Let's do one last quick scenario test. When we're talking about population health management, which of the following is a true example of disease management? Is it providing access to care, giving information on medications, empowering clients, or helping them develop health-seeking behaviors? The answer here is providing information on medications. Don't get me wrong, empowering folks and ensuring access are incredibly important, but giving specific info on a medication, that is a very direct, micro-level disease management intervention sitting right inside that larger population health framework. So I want to leave you with one final, absolutely critical thought to chew on before your exam. True population health equity means we have to address the upstream factors, the real social, economic, and environmental conditions that actually cause illness in the first place. We can't just stare at electronic health records that, honestly, often completely ignore those social determinants. So, as you step into your new clinic manager role, how are you going to move beyond the clinical data on the screen to actually tackle those upstream factors and create lasting equity for your community? Think on that. Study hard, trust your instincts, and I know you are going to absolutely ace this exam.